If we speak of cognitive impairment in general, until now, the only way to prevent, or I like your word postpone, I think postpone is probably better than prevent in this case, to prevent cognitive impairment is to treat vascular risk factors. It's not so easy to prove that the treatment of vascular risk factors will prevent or postpone the occurrence of dementia, because when you treat vascular risk factors, you prevent mainly myocardial infarction and stroke. And when you perform a trial and when you show that the treatment is effective to reduce MI and stroke, you have usually to stop the trial for ethical reasons. And to show an effect on dementia, to prevent dementia, it takes a lot of time, because dementia is not something you can diagnose within 2 or 3 months in people who are cognitively not impaired before. So it takes time, and usually this is a major issue. Usually in secondary or in primary prevention trials, we have to stop the trial before we show an effect of cognition. The only exception is with a very old trial called SISTER, published more than 20 years ago, trial of treatment of systolic hypertension in elderly people. And in this time, more than 20 years ago, it was still ethical to give a placebo in elderly people with pure systolic hypertension. And so it was possible to show some effect in this trial. Now it's not ethical anymore, because we have proof that treating high blood pressure is effective to reduce MI, stroke, and renal disease, and so on. So it's more and more difficult to show an effect on cognition. From my presentation or the other presentations that came in the same session, the message is that to protect our brain, to prevent cognition, we have to treat vascular risk factors to prevent vascular disease. So, and the best way to prevent vascular disease is to control blood pressure. So to have the blood pressure recorded sometimes and treated if it's high, and to have physical activity. And it's also good to have a dosage of the cholesterol from time to time, and to treat high cholesterol. These are probably the best ways nowadays to prevent or to postpone cognitive impairment. It may change if in the future we have treatment of Alzheimer's lesions of the brain, but for the moment it's not the case. So we have to treat vascular factors.